Real wide. There, you got it.
Come out further.
Yeah.
Oh, you know we shouldn't have the ultra care.
Doesn't matter.
Doesn't matter?
Doesn't matter.
Okay.
I'm not so concerned about product or anything like that. Open real wide.
I think
Rest.
we're fine, because, I mean,
That's what you want.
doubling up with what
Okay.
Yay.
Better?
Mm.
Open a little bit more. Okay. You okay? Spray the Isolite down. We'll insert this into his mouth. And Francois, if you can tip your head back for a second. Anything going down your throat or getting by there?
Move the bottle. There we go.
Yeah. You getting any water that's going past? Okay.
Yay.
Better? Open a little bit more. Okay. If we use an Isolite that's too small, we're going to have gaps. We're not going to get a good seal, and water's going to go down the patient's throat. But sometimes the amount of opening the patient has limits us from the amount of opening that we can put an Isolite into, so then we have to do other matters and other means. And what I'm going to do now is show you, if I use an Isolite that's too small, how we can go ahead and block out any water from going down the throat. So, let me attach this for a moment.
Do you want me to pick that up of you attaching it? Or
No.
Okay.
I'm going to need some blue mousse, Rita. Spray the Isolite.
Tara?
Tara.
Tara.
You.
Okay.
Yeah, good.
Putting
good.
it in there.
Yeah,
All
good,
right,
good.
and we're biting down, and we're
And
pushing
tuck it
back.
in.
Tucking in.
Super, great. Okay.
Wonderful. Okay, good.
Good, okay. Yeah, right in the cheek. Good. 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 Yeah, move it back a little bit more that way. Push it back a little more.
Yeah.
Super. Excellent. Okay, go. Okay. Yeah, super. Good. Perfect.
Excellent.
Okay. Now
Okay.
do this.
Does anybody's feel too big?
Yeah, excellent. Good. Good, good, good,
And you're
good,
nodding?
good, good.
You're nodding that you
Yeah,
got it
good.
in?
Yeah, you got it. Okay.
Excellent.
Shot went
Okay.
Sweet, let me see.
Good. And if we do it all at once, just like this, from here, it goes bloop, like that. Okay, good. Yeah.
Because we can't see.
Yeah, so here, it's like this, like that. Just there you go. Okay, good. Okay, your turn.
Just, yeah.
Okay, good. Yeah, that's good. Okay, cool.
Good.
Okay. Okay, good.
Good.
Okay, good.
All
Okay,
right.
you guys switch.
Wonderful.
Easier here, like this. Like that. Just there you go. Okay. Good. Okay, your turn.
Okay. Perfect,
Yeah,
guys.
yeah,
This
yeah,
looks
yeah.
really good.
Good, good.
Mhm.
Okay. Okay, good. Yeah, that's good. Okay, cool.
Good.
Okay. Can you up and wider, bigger, or no?
Try 3.
No, okay, no, okay.
No. Okay.
Okay.
And going back to 2.
There we go.
That's good. Let's lubricate the tip there. Good.
Okay, pass it to me.
All right.
Put it on.
Put it on. And then hand her the sprayer.
Push them both together at the same time, because you've never done this before. Backside. Okay, good.
Okay, can we do that spray again? Just 1 second. It kind of be. Don't move around as much. I know it's tough,
Oh,
but
sorry.
Turn it
Okay.
over. I'll just spray it.
Okay.
Would that work, or should she?
let's have you do it just because it's easier in the wide shot to see that.
Whoops. We're out of air. Hang on.
Okay. Stopping.
Here. And rest.
Nice nodding of the head, Tara. Great.
Down, good. Okay. Do that again.
Okay.
Okay.
I'm going to position you. Good. Yeah, good. Yeah, that's good.
Is it okay, Yolanda?
Yeah, yeah.
And
good.
can you look kind of
Very
straight
good.
up at
Pull it forward like this. Hold on to it with your index finger. And once again, we're just going to insert this isthmus area right into the cheek. Open, please. Into the cheek very gently. That way we stay away from those gag-sensitive areas. Release your index finger and pull the bite block back into position. Tuck it in, and there you go. One hand, it's an easy insertion. For some people, this works very, very nicely. For other people, they like to do it the way that we've described earlier with two hands. Any way that you do it, be smooth, be gentle, and be considerate of your patient. Never try and force anything into somebody's mouth. If you want to see how to gag somebody, this is how to do it. Open real wide. Take this thing, open wide, put it in their mouth like that, and just start pushing down towards the back of their throat. You're going to gag them real fast. Don't do that. Don't do that. Let their lips. Good. Second thing that we want to do is we want to go ahead and moisten the mouthpiece. And so, thumb and index finger, and here we go. Once you open really wide, I'm going to take the isthmus to the corner of her mouth and keep the whole whale's tail or cheek protector outside of the mouth. Now, folding it forward, I insert this into her cheek, which is a non-gag sensitive area. And once it's in the cheek, I then gently pull across the bite block until I have it in the appropriate position, and I have her rest on that bite block, and the bite pillow goes down and rest, and then just gently tuck this in. Tuck it in there, and there we have it. We've got some pretty nice isolation back there, as you can see. Maybe later on today we'll go back in and do some of these fillings. Now I've got plenty of working room to work in her mouth. I could do 18, 19, and 20. I do this just as I do any normal regular insertion, isthmus to the corner of the mouth. I then fold the cheek protector forward and slip the Isolite into her cheek over here. I then fold the isthmus forward and slip the Isolite into her cheek right here. Very gently, I bring the bite block across, make sure we call it the bite pillow, and have her rest on that just about at the cuspid area. And now I'll go back and I will tuck this right into the corner of her mouth. And look at the isolation that we get there. It's just incredible. Now, I can work on that all day long. Now, you may look at this and you may think, boy, that's awful close to those teeth on the lingual surface. Well, yes, it is. But if all I'm doing is you may think that this is really close to those teeth, to the lingual surface of those teeth. You may think that the Isolite mouthpiece is really close to the lingual surface of the teeth right there. And you know what? It is. But if it's not going to get in my way and I'm just doing occlusal composites or occlusal fillings on 18, 19, and 20, good. Yeah, good. Yeah, that's good.
There's a little Vaseline on my lips.
Good. Where are you going to put that Vaseline? Right.
Okay.
all right.
And open for me. Open wide.
Just like a pro. Look at that.
Okay. And just bite on the.
And ask him,
Perfect.
is it comfortable?
Is that
Is it
comfortable? A little Vaseline on my lips.
Good.
Where are you going to put that Vaseline? Right.
Okay.
All right.
And open for me. Open wide. Good.
Just like a pro. Look at that.
Okay. And just bite on the.
And ask-
This is how I do it.
Okay, and bring it back in front of you. Connecting it.
See it?
Mm-hmm. And now come down with it right there, right next to him.
Fasten her lips here. Okay, honey, open real big.
Bring the front of the
quite so hard. Open a little bit. Open real big for me again. Here, you guys ready?
Yeah, Cameron, keep your hand out of the shot. Thanks.
Yeah, we can say.
Now listen, move over. Move right over there. Go.
All right, good.
Can you close just a little bit? Right there.
All right.
There we have it.
Does it feel
Go a little
comfortable?
bigger. Squish right down a little bit right there. Good. Right down right there. Hold it. Is that comfy? Is it comfy? Is it pinchy anywhere? Okay.
All right, good.
Can you close just a little bit? Right there.
All right.
There we have it. Good.
Does it feel
Make it a little
comfortable?
bigger. Squish it right down a little bit right there. Good. Right down right there. Hold it. Is that comfy? Very comfy? Is it pinchy anywhere? Okay. I am going to squirt some water in your mouth. Watch this. Here we go. Here's making me thirsty. Pretty cool, huh? Okay, let's take this out. Open really big. Okay. Can you pucker your lips like a kiss? Kind of tastes kind of good.
Yeah.
Now bite down a little bit. Hold that right there. Give you just like that. Okay. I'll turn the vacuum on. Any water going down your throat?
Put your head in the shot. There you go.
Can I put it in on the other side? Yeah? Open up. Is that okay? Give me a thumbs up. Yay! Okay, open real big. To the camera. Bite down a little bit.
You got water on your nose.
What's that?
There you go.
Look at that. Can you tip your head a little tiny bit lower? Give me a smile.
Look at
Look
your
at the
dad. Look at
camera.
your dad when you smile.
Yeah, okay. Open big.
This is just as good as your big sister.
Okay. Okay. Can you open really? Oh, look at how big you open. Girl. Now, bite down a little tiny bit, Perfect. Enough to hold that in place. Good. Let's take it out now, and let's put the other. Now bite down a little bit. Hold that right there. Good. Just like that. Okay. To the camera. Bite down a little bit.
You got water on your nose.
You won't feel anything at all.
Okay.
And then we'll start on the top. Okay, open real wide for me for a moment. Beautiful. Okay, and now lift it. And now the mouthpiece insertion is very easily. Holding it very gently in my thumb and my index fingers, I take the isthmus of the mouthpiece to the corner of the mouth on the side that I'm working on. And I'm going to fold the whale's tail portion forward and gently slip this into her cheek area on the right hand side. Once I have that in position, I'm then going to gently take the bite block and move the bite block back onto the biting surfaces of the left hand side. Bite down for me and just rest there. And then just gently get her lip out of the way and then tuck, as you can see right here, I'm going to tuck the tongue protector up into the lingual vestibule up there, getting this right back behind the retromolar pad. Once again, the insertion is very easy and it's in one fluid motion. Isthmus to the corner of the mouth, gently fold the cheek protector forward and slide the isthmus area into the buccal vestibule, and then you gently pull back the bite block onto the biting surfaces of the left-hand side and tuck it in, and we're ready to go. Tuck in the lingual flange with my finger. Take the isthmus of the mouthpiece to the corner of the mouth on the side that I'm working on, and I'm going to fold the whale's tail portion forward and gently slip this into her cheek area on the right-hand side. Once I have that in position, I'm then going to gently take the bite block and move the bite block back onto the biting surfaces of the left-hand side. Bite down for me and just rest there, and then just gently get her lip out of the way, and then tuck isthmus to the corner of the mouth, gently fold the cheek protector forward and slide the isthmus area into the buccal vestibule, and then you gently pull back the bite block onto the biting surfaces of the left-hand side and tuck it in, and we're ready to go. Tuck in the lingual flange with my finger, tuck in the buccal flange with my tongue, and we're ready to go. And go. Now, and then we're going to let your rinse really, really get open. Really big for me. Okay. Slide for me. Put the Isolite in, slips in all of about 3 or 4 seconds, and just have her close down on that. Good. Pushing side, we want to make sure the patient does not close. Open real wide for me, because if you close it tastes really yucky, then you want to rinse out again, so we just switch it right on over. And you can see just how easily the Isolite switches from one side to the other. Close down and rest. Open real wide for me, because if you close it tastes really yucky, then you want to rinse out again, so we just switch it right on over. And you can see just how easily the Isolite switches from one side to the other. Close down and rest. Hit the other side now, and then we're going to let your rinse really, really get open. Really big for me. Okay, good. These are single-use items. We open them up, take the mouthpiece out of the package. That just allows the mouthpiece. Simple rotation motion allows us to slip that into place just like that. Very important to put Vaseline, apply it liberally to the lips. This allows the mouthpiece to goes gently into the cheek like this, and then we just pull the bite block across and put that just distal to the cuspid, and have the patient lightly close down on that, and just rest for me. Good. Open again for a second, and gently rest right there. And as we can see, the mouthpiece, I turn the light on here, the mouthpiece illuminates this very, very nicely. Put the Isolite back in again. Open, please. Notice how she folds it forward, positions it into the cheek, and then pulls it across.
Okay, bite on it gently.
Fits in there. The back end of the Isolite mouthpiece is already moistened, so this is just going to slip right into place. And as you can see, about 3 seconds, we're ready to go. Right. Notice how she folds it forward, positions it into the cheek, and then pulls it across. Fits in there all in about 3 seconds. So this goes gently into the cheek like this, and then we just pull the bite block across and put that just distal to the cuspid, and have the patient lightly close down on that, and just rest for me. Good. Open again for a second, and gently rest right there. Slip this in the mouth. Close down gently for me. And isolation is achieved in about 3 seconds. No. Once again, are we still rolling?
You're still rolling.
Yeah,
Okay.
still rolling.
Okay. Gently folding the cheek protector back towards the tongue protector and inserting this gently into the cheek over here, not placing it down the floor of her mouth, not placing it down the center of her mouth. And close down for me. And close down for me. Her lips are lubricated. When we insert the Isolite on this side, I hold it very gently, folding the cheek protector back towards the tongue protector and inserting this gently into the cheek over here, not placing it down the floor of her mouth, not placing it down the center of her mouth. let's insert this
Light off.
light off. And you can see how it rests right on that tori, pushing against the tori without any problem whatsoever.
Is a nice rest for their jaw as they bite down. They don't have to stretch open or hold open. There's a complete barrier toward the back of the throat.
Folded it like the instructions told me to, and it worked out perfectly. It fit right around the back of his last molar, and we were able. I saved time by not having to reach for the suction or readjust my light. The only hurdle I had was my own intimidation of placing the mouthpiece, but after 2 or 3.
I think that's about right. Okay.
That's just what you want me to use? Lift your head back for me a little bit.
I think that's about right. Okay.
That's just what you want me to use?